is Viola. I'm a student at University of Detroit Mercy. I'm going to be performing a head-to-toe assessment on you today. Is that okay?
Yep.
Okay, I'm going to wash my hands and we'll get started.
Okay.
Can I see your wristband? Can you tell me your name and your birthday?
Emily Perrin, March 7th, 1982.
Okay. And do you know what day it is today?
Thursday,
Okay, and the year?
2013.
Okay. Are you having any pain right now?
Nope.
Okay. Do you have any allergies?
Nope.
Okay. Patient appears to be your stated age. She appears well nourished. She appears slouched, but there's no signs of body odor, and she seems to be well groomed. I'm gonna check her. I'm gonna palpate her head for any lesions or lice. Okay, there's no present lesions or lice. Next, I'm gonna check her. I'm gonna check her eyes. Okay, and can you focus on my nose? Pen light, checking both eyes. Okay, and can you focus on the pen light here? Okay, pupils are equal, round, reactive to light, and for accommodation, they constrict when the pen light gets closer, and then they dilate when it gets farther. Next, I'm going to check her face for cranial nerve 5. Can you close your eyes? Okay, can you feel this? Can you feel this?
Yeah.
This?
Yeah.
This?
Yeah.
Okay, you can open your eyes. Can you open your mouth? Okay, and her oral mucosa seems, it's pink and moist. Her tongue appears rough. Can you stick out your tongue? Okay. Her uvula, can you say appears to be midline, and tonsils are present. Okay, you can close your mouth. And next, I'm going to check her lymph nodes. Here, I'm going to check the pre-auricular, okay, the post-auricular, back here, the occipital, okay, the submental. Okay, then there's no signs of inflammation. Next, I'm going to pinch her skin, skin turgor for dehydration. Okay, and there's no signs of dehydration. Patient's hydrated. Okay, and then next I'm going to check her carotid pulses one at a time. Okay. Okay, pulses seem to be equal bilaterally. Next I'm going to listen to them to check for bruise. Step out of the stethoscope. Okay. Can you breathe and hold it? Okay, good. Next one. Okay, good. There's no presence of bruise. Next, I'm going to listen to her lung sounds. Okay, and then there's 8 in the anterior side. Can you breathe in? Out, in, out, in, out, in. Okay. In, out. Okay, and then I'm going to check her for her laterals. In, out, then the other side. In, out. Okay, next I'm going to listen to her heart sounds. Okay, and the right second intercostal space, this is the aortic. Okay, and the left second intercostal space, this is the pulmonic. This is where S2 is greater than S1. And this third and left intercostal space, this is the herbs. This is where S1 and S2 are equal. And then the fourth intercostal space, this is the tricuspid. And down here, this is the mitral valve. Okay, and this is the apical heart rate. I'm going to listen to it for 60 seconds with the pelvis stethoscope. Okay. Next, I'm going to check her skin. Okay. Skin appears to be dry and intact. It's warm to touch. I'm going to feel her brachial pulses at the same time. Okay, they both appear to be equal bilaterally, and then her brachial pulses, radial pulses. They are both equal bilaterally. You put out your hands. Okay, and now I'm going to check for capillary refill. Okay, and the skin goes back from pink to white within 1 to 2 seconds. There's no signs of clubbing. Okay, and then I'm going to check if you can just have you turn around. Okay.
Is this good?
Yes, this is good. I'm going to check your posterior, 8 posterior lung sounds. Can you breathe in? The AP diameter is 1 to 2. I'm going to check the CVA reflex for any tenderness. Let me know if you feel any pain. Any pain?
No.
No? Okay, the other side.
No.
Okay. And then I'm going to have you lay down. I'm going to check the abdominal area. Okay, and I'm just going to lift up your shirt. Okay, first I'm going to inspect the area. There's no signs of lesions or scars. There's no signs of edema. Next, I'm going to listen to her bowel sounds. I'm going to start in the right lower quadrant. Before I start, did you have to go to the bathroom?
Nope.
Okay. After right lower, I'm going to go up to the right upper. Okay, and then the left upper, left lower. Okay. Bowel sounds are present and active. Next, I'm going to percuss over the area. Over the organs, I'm going to hear a dullness sound, and then over everything else, I'm going to hear a timpani sound. In the right lower, there's the appendix. Okay. On the right upper, there's the liver. In the left upper, there's a spleen. Okay. Then the left lower, there's a sigmoid colon. Okay. Next, I'm going to palpate the area to check for tenderness or any masses. Let me know if you have any pain. Okay. Okay. And down the abdominal area. Okay. I'm gonna have to turn around. Before I go down to the lower extremities, I'm going to check for conjunctiva. And it appears to be pink and moist. Then now I'm going to move to the lower extremities. I'm going to check her skin first. Okay. Skin is warm to touch and it's dry and intact. Next, I'm going to listen to the popliteal pulses. Okay. Then I'm going to listen to the posterior tibialis pulses. They're both equal bilaterally. Then I'm going to listen to the dorsalis pedis pulses. They're both equal bilaterally. Okay. Then I'm going to check for the Babinski test. Okay. The test appears to be negative. Then I'm going to check for capillary refill. If there was no nail polish present, there would be capillary refill, and it'll be within 1 to 2 seconds. Okay, and then I'm going to have you stand up. Okay, and then now I'm going to observe your gait. I'm going to have you walk from here to the couch. Okay, and then when you turn around and you walk back, I'm going to have you walk heel to toe. Okay. Now I'm going to have her you can close your eyes. I'm going to check for the Romber's test and see. I'm going to stay on her side to make sure she doesn't fall. Okay. And okay, I'm going to check for 20 seconds. Her gait is steady. She's not. There appears to be no swaying. Okay. Now I'm going to have you bend over and touch her toes. Okay. And I'm going to check her spine. Okay. The spine is midline. Okay. You can get up. to my head to toe assessment.